I am Dr. Muralidharan Parthasarathy, surgical gastroenterology consultant and laparoscopic surgeon, Kauvery Hospital Chennai. Today we will talk about gallstones, the various symptoms because of gallstones, common presentations because of gallstones, how we diagnose, and more importantly, how we treat patients with symptomatic gallstones. So the common question is, why do some patients develop gallstones? So in fact, gallstone problems is quite common in India. In fact, the Western literature estimates that 1 in 4 women and nearly 1 in 10 men do have gallstones. Increasing age, patients who are overweight, diabetic patients have a higher frequency or chance of getting gallstones. Coming to the symptoms are quite varied with gallstones. The most common symptom due to gallstones is pain in the upper tummy, usually on the right hand side. Some patients experience this pain to move to the back and to the shoulder. This is called biliary colic. Some of these patients experience this pain usually after eating a fatty food. The other symptoms might be when the gallbladder gets inflamed because of gallstones. We call this cholecystitis. These patients present with severe tummy pain in the same place, as well as vomiting and quite high temperature. There are quite serious consequences because of gallstones. This might be in the form of obstructive jaundice, where the patient's eyes become yellow and urine becomes very dark. Gallstones can also lead on to what is called cholangitis, which is infection of the bile tubes, as well as pancreatitis, which is inflammation of the pancreas gland, which is a gland which helps to digest the food what we eat. Coming to the diagnosis, diagnosing a patient with symptomatic gallstones is quite easy. We need to take a thorough history from the patient and then run a few blood tests, usually in the form of liver function tests, and then do an ultrasound scan of the abdomen to find out if the patient has got gallstones. One important thing is, there is a group of patients who do have a diagnosis of gallstones picked up on a scan done for a completely different reason. We call this as incidental gallstones. I recommend these patients to be seen by an expert surgical gastroenterologist who will go through the patient's history, the scan results and their blood tests, and they will advise the patient accordingly. Once we make a diagnosis of symptomatic gallstones, the treatment is very straightforward. The recommended standard treatment nowadays is an operation to remove the gallbladder together with the gallstones. This is called cholecystectomy. This is done as a laparoscopic keyhole procedure, wherein the patient will have 4 tiny cuts in the tummy. This procedure is done under general anesthesia, and the patients are usually discharged the same day or the day after. Usually they will need some painkillers after the operation, but in about a week to 10 days, most of the patients will be back to normal. One important thing is that there is no long-term consequence in removing a patient's gallbladder. In summary, patients with right-sided upper tummy pain, especially after eating fatty food, and again especially if they are women in their 40s or 50s, should seek expert surgical gastroenterology opinion so that things can be sorted much easier at an earlier stage. Thank you very much.